I will keep an eye on the wait room, but I know we've got a lot of information to get through tonight, and I want to give our speakers plenty of time. So we'll go ahead and get started. Let me start by saying Happy New Year to everyone. I know that so far 2021 feels a lot like 2020. Fingers crossed it's going to be a different kind of year. So thank you all. I think most of the people here have attended one of our town hall meetings before, and we thank you for coming back. We're holding these meetings every other Tuesday from 6 to 7 p.m. They're part of our larger community effort to assess our local childcare system and work to improve it, to make high quality, affordable childcare available to all families in Door County, and also to pay our childcare providers a living wage, if not better than a living wage. So all of those things combined are what we are working on, and we are, through these town hall meetings, we are covering a broad range of topics and engaging in community discussion. So I thank you all for joining us. Tonight, we're going to learn about the Wisconsin Shares Child Care Subsidy Program from two individuals with extensive knowledge and experience. We've got from the Wisconsin Department of Children and Families, Barb Honsa and Rose Prochazka. Mm-hmm. Okay, so I'll give you just a little bit of background about them. Barb is the Regional Child Care Coordinator in the Northeastern Regional Office of the Bureau of Regional Operations. She's been working with the Wisconsin Shares Child Care Subsidy Program in one role or another for over 19 years. She oversees 17 counties and 3 tribes who administer the subsidy program, as well as the child care certification programs at the local level. She answers all of the Wisconsin Shares Child Care Subsidy policy questions from the local agencies in the Northeastern region. She says when she has a question that she can't answer, it goes to Rose. So Rose is the section manager for the Wisconsin Shares policy team, and she's been working with the Wisconsin Shares program for the past 10 years. Previously, she worked with Wisconsin Works program, and I personally am unfamiliar with that. So maybe Rose will tell us a little bit more about that. She has 35 years of experience working with families in a number of different roles, including job development, employment counseling, working with domestic abuse programs, parenting education, and facilitating a variety of workshops. So as you all can tell, we're in very good hands tonight for people who are going to help us learn more about the subsidy program. And there's a set of slides that Rose and Barb are going to go through. They've asked that we hold questions till the end. Barb and Rose, I'm going to hand it over to you, and you can decide. We have a small enough group. If you want to get a sense of the group, that's fine. If you just want to jump in to the content and then have discussion later, that's fine. People should still feel free during the program, if you have a question and you want us to track it, to put it in the chat box, and we'll be sure to circle back around to those when we get to the Q&A portion this evening. But otherwise, I want to thank Rose and Barb for joining us and hand it over to them.
Thank you. And I wouldn't mind going around and hearing who's here and kind of what their background is and their interest in the program. That would be good for me to hear.
Do you want me to call out names? I can start with the order in my screen. Top left is Corey McFarland.
Hello, I think Barb and Rose both know me. I'm Corey McFarland. I previously worked with Barb in the regional office for the Department of Children and Families. And 5.5 years ago, I came to work for Door County Department of Health, which is now Health and Human Services. And I'm the deputy director there. So child care eligibility is one of the programs that's included within our department, along with many others.
Thanks, Corey. Next on my screen is me. And so I'm Christina Studebaker. I've been with United Way as a community impact coordinator for 1 year, and I head up the community impact area of financial stability, which includes things like housing and childcare. And so I have been sort of leading the charge within United Way for the Child Care Initiative. Next, we have Amy Conley.
Hi, Amy Conley with United Way. I'm our director. I've been here 21 years, so kind of have my fingers in everything, especially before we brought on staff such as Christina. I did work in childcare many, many moons ago, and are familiar with childcare rules, regulations, things like that, and just, of course, passionate about children and their future.
Next, I have Alexis.
Hi, I'm Alexis Heim-Peter. My day job is with the Department of Natural Resources. I'm a wastewater specialist, but my side hustle is a county board supervisor for District 13 downtown Sturgeon Bay. And I'm also a mother to Jackson James, who will be 3 in a week. And so I not only serve as an elected official for the county, but also have a strong vested interest in childcare, and was hit pretty immediately with the COVID and all of that kind of stuff, and have become very familiar with childcare issues in Door County and with the providers here and that sort of thing. So I don't have too much direct knowledge. I've gotten up to speed quite quickly in the last few months, and appreciate the opportunity that United Way has presented with these town halls and the learning opportunities. So thank you.
Thanks, Alexis. Jane.
Hi, I'm Jane Wise. I live in Bailey's Harbor. I'm retired, and I am a volunteer at the Northern Door Children's Center in Sister Bay. My husband's on the board there. In the late 70s, I was a mom who had to put her children in some sort of childcare, much to my regret. And that was a little bit of a struggle. And so I think because of my experiences then, I feel very strongly about providing a safe, loving, healthy environment for our children. They are our future. And I'm very interested in doing that. Still volunteer there, and actually was employed a little bit this past year and a half due to COVID, partly at the Children's Center, and had fun there.
Thanks, Jane. Next, I have Missy.
Hi, I am Missy Allen. I am on the United Way Board of Directors. Also am a sales manager at Jim Olson Motors. We've got approximately 85 employees, many of whom have childcare issues. So I have interest from that standpoint, as well as from my heart, and being a grandmother of 7 grandchildren. Virtually all of whom are in single parent families. So have a very high interest in how all of these things come together.
Mm-hmm. Thanks, Missy. Next, I've got Margie.
I am Margie Hageney. I am a member of the community who's had a passion for this topic since the early 80s. My graduate work was in early childhood education. I did Head Start work in inner city Detroit, was the director of early childhood programs, and alas, I'm one of those people that couldn't keep working 3 jobs in order to stay in that field. So I took the scenic route through a lot of businesses and industries, and I'm currently a self-employed leadership development coach for pre-K through 12 education and healthcare systems.
Thanks, Margie. Rosemary.
Hi, I'm Rosemary Stube, and I'm a retired high school English teacher. My husband and I moved to Sturgeon Bay about 1.5 years ago, and I've been working with the United Way Community Investment Committee. And I don't have any background in early childhood education per se, but I'm just a very interested member of the community.
And we like that. Thank you. Next we have Annika.
I kind of missed the beginning. I'm sorry. I'm introducing myself.
Yep.
And okay, so I'm Annika Paulson. I'm an optometrist at Door County Eye Associates. And I am working with Christina on the United Way Task Force for long-term child care solutions. I think I got that pretty close to what it is. And I became interested in our child care crisis after we lost an employee at the beginning of COVID because she couldn't find childcare, so she just could not come to work anymore. And my dad let me know, 30 years ago when I needed childcare that he had to work with a group of parents to set something up. And I was just kind of shocked that we're still trying to find a solution to all that. So I felt like I wanted to get involved and figure out what we can do.
Thank you, Annika. Next, I have Terry.
He's muted.
I don't know if he's actively tracking. Maybe not. Okay.
Good evening, all.
Good.
Sorry about that. Yeah, I work with DoorCountyDailyNews.com and the radio stations. I'm kind of following along on this here, just going to see what comes of it all and for a follow-up tomorrow. Now, you'll look at the screen there. You will notice that the lips are not moving. That is an image I put out there probably for everybody's best benefit because my current appearance, live appearance, frankly, would do absolutely nothing to add to the whatever is going on here. So you can thank your lucky stars, whatever God you serve or pray to, that we have that picture up there. Don't ask me how old that bloody thing is. So.
Thanks, Terry. And we're going to make you now come to all future meetings for Comic Week because we really like that perspective.
Okay, we can do. I can do a monologue, I suppose. I don't know, just to get things off there, and then get on with the rest of the show.
Awesome. So then, lastly, I have Logan Thomas. Is what name is appearing on screen?
Hi, I'm with Door County Knock. And I'm doing something similar to Terry, just listening on for a possible article later.
Awesome, thank you. So that's who the screen is, Rose and Barb.
Okay, I'm going to begin sharing my screen to show you the PowerPoint. Okay, you can all see the screen, correct?
Yes.
Okay, good. Then we can get started. This page is really just our contact information, Barb's and my contact information. I wasn't sure, Christina, whether you're going to be sharing the PowerPoint slides with folks or not. If you do,
I will.
Sure. I think that would be a helpful thing to do because there's some web links inside here and our contact information that might be helpful for folks.
Absolutely.
Mm-hmm. So today what we're going to do is give an overview of the Wisconsin Shares Child Care Subsidy Program. I'm going to talk about the eligibility and authorization process, and then also talk about some of the changes that have taken place with the program over recent years. Beginning back in 2014, the federal regulations were modified. We had a reauthorization of the Child Care Development Block Grant. And since that time, there's been a number of changes, and we'll go through those a little bit. So this page here is showing you how to find where to apply across Wisconsin. So Wisconsin shares contracts with counties and tribes across the state to administer the program. In Milwaukee, DHS and DCF directly administer the program through Milwaukee Enrollment Services and the Milwaukee Early Care Administration. So the web address that's shown on this page, if you use that web link, it will bring you to a map that looks like what is shown on the screen. And that screen then will show you exactly where the family would need to go to apply. including address and phone contact information. So I just want to encourage you to feel free to share this kind of information with the families you work with. This might be really helpful to help make sure families are aware of how to access the program. Next, I want to talk about the regulations behind the program. The Wisconsin Shares program in Wisconsin is funded through two federal sources. One is the Child Care Development Block Grant, and the other is the Temporary Assistance for Needy Families, otherwise known as the TANF program. So both of those federal sources fund the child care program in Wisconsin. So consequently, when we develop our program rules, we need to follow both of those sets of federal rules. And in addition to that, we have Wisconsin statutes that we need to abide by, and then the Wisconsin Administrative Code, which is instructions for how the department should administer the program. And particularly that is chapters 101 and 201 in the Administrative Code. All of our policies within the program are based on those regulations. And if you have any questions about theirs, I've included the resources for where to find those federal resources and the Wisconsin statutes and laws that guide the program implementation. This page is going to show you a little bit about who are the families that we serve in our program. So nearly 35,000 children each month and nearly 20,000 families are served in the program. This chart is actually showing you data from September 2019 or 2020, I'm sorry. However, this data is very much the same no matter which month you look at. Most of our families are very poor, which this chart shows you that the largest share of our families are under 66% of the federal poverty level, and very few families are at the higher levels of income. This screen is going to become important when we get a little bit further on in the presentation, where I talk about the income level for families to become eligible. The income threshold for initial eligibility begins at 185% of FPL. So if a family is over that amount of income, they would not become eligible for the program. Very few families over time actually see their income increase. As you can see by this chart, very few families are served at the higher income levels because most families don't see income increases. And that's because jobs don't pay more than that. Most people who start out with an $8 an hour job are still in an $8 an hour job years later. So how do families apply? There are some easy ways for families to apply in addition to contacting their local agency directly. They can apply online at access.wisconsin.gov. They can call their local agency, that numbers for that contact information is on the page that was a few pages earlier with the local agency contact information. Or they can contact their local agency, their local tribal or county agency in person. Many agencies are still holding some in-person meetings. So it would be up to your local agency whether they're actually holding in-person meetings right now with families. When families do apply, there will be a number of verification items that they need to submit during the application and eligibility process. Parents will receive a written notice to let them know what verification items are needed, and they have 7 days from the date of that notice to provide that verification as part of the eligibility process. Another component of eligibility is that families must be engaged in an approved activity. There are a number of financial and non-financial eligibility criteria. one of which is the engagement in either employment or another activity that will lead to employment, such as a combination of work or education, or the Wisconsin Works program, otherwise known as W-2. So this list will show you what some of those things are. The FSET program, which is the Food Share Employment and Training Program, certain components of that. Also, a combination of English as a second language combined with work, or basic education combined with work, or post-secondary education combined with work. And for teen parents, they do not need to work, but they would need to be enrolled in high school. This page shows you the financial eligibility criteria. So in this slide, you can see that at the application point in time, families need to be at or below 185% of the federal poverty level. Shown here are the 2020 income limits. These numbers are updated annually when the federal government issues the revised poverty guidelines. This will usually come out in January. So we're watching for this in the Federal Register at this time. So in this example of a family of two, a mother with one child, she would be financially eligible if she's earning about $15.25 an hour, working full-time at 40 hours a week. She would pass financial eligibility. So, however, as you'll noted on the previous screen, many of our families are not even at that level of income when they initially apply. The next page shows you the upper limits of financial eligibility. So one of the changes that took place when we did the Child Care Development Block Grant reauthorization in 2014, agencies or states had a few years to get all of those changes in place. This change was implemented in, I believe, 2017, where we increased the financial eligibility up to 85% of the state median income. This chart shows you exactly what that number is. And again, this is for 2020 income levels. Again, will be updated when we get the 2021 information. So once a family is determined financially eligible, they can continue to remain financially eligible until the family reaches this income threshold. So in our example of a family of two, a mother with one child, this would be about $25.45 an hour working full time. This is one of the changes that did take place. However, you'll also note that very few families will go from a $15 an hour job to a $25 an hour job over a short period of time. That's rather uncommon. It takes, we have not seen a lot of that occur since we have increased the financial eligibility threshold to 85% state median income. There's very few families who reach that threshold. Other eligibility requirements include Wisconsin residency, address verification, proof of the approved activity, and oftentimes if a family is employed, it would include evidence of pay stubs and their earned income. Families also are obligated to cooperate with the child support program, which assists them in identifying the absent father and getting support orders in place for the children in the home. Parents are also required to report a variety of changes that could affect their eligibility or their authorization within 10 days of the change. So all of these rules and regulations may seem daunting, but they are in place because of laws that we need to follow, whether they're in federal regulations or state regulations. These are rules that families and that we need to impose because of the regulations that guide the program. For children in the program, children must be US citizens or qualified immigrants. They must be 12 years old or younger at the time of the application. However, once found eligible, they can remain being served through the 13th birthday or until the next consecutive eligibility renewal. Children must reside with a parent who is financially eligible and non-financially eligible, and they must attend a regulated child care provider. A regulated provider is a provider who is certified, licensed, or overseen by a public school board. I'll have a little bit more on child care providers in just a moment. So the authorizations that are written following the eligibility determination, parents need to provide the authorization worker with their work or approved activity schedule, the child's schedule, including school or other activities in which the child would not need child care, and the child care provider that the child will be attending. Parents can search for an eligible child care provider at the Child Care Finder webpage, which is listed there on this screen. They can also contact the local resource and referral agency, which in Green Bay would be the Family and Child Care Resources of Northeast Wisconsin. You can also do a web search for Supporting Families Together to find all of the child care resource agencies across the state, if you happen to be located in that area. Child care provider requirements. Child care providers who want to serve families who are eligible for Wisconsin Shares must meet certain requirements. They must be regulated, must participate in Young Star, and must sign a contract with FIS so that the funds can be transferred excuse me, to their bank account with the parent's EBT card. The Young Star adjustment is also done by a transfer from the FIS to the provider's bank account. So that is important for the provider to get paid. Child care providers accept payment from enrolled families through the My Wisconsin Child Care EBT card. Payments can be completed through a point of sale device that the child care provider may rent from FIS, or the payments can also be made online or by phone. Parents can only use their Wisconsin Shares subsidy to pay for child care provider who is listed on their authorization. So if a family decides to change child care providers, they must notify their local agency ahead of time in order for those funds to be available to a different child care provider. One thing that gets really confusing for families and for child care providers is the difference between the copayment and the parent share. The copayment and what is known as the parent share are very often confused. The copayment is technically an amount that is reduced from the subsidy based on the family's FPL, the federal poverty level, and the number of children in subsidized childcare. The parent share is the out-of-pocket cost that parents may still owe the child care provider after the subsidy funds have been paid. So that's an interesting thing that people need to be aware of. The copayment has nothing to do with how much, well, it's not directly related to how much the family needs to pay out of pocket. As the family's household income increases, their copayment will increase also. So that means their subsidy amount will decrease as their household income increases. So in general, people need to be aware that there will never be two families, or rarely be two families, who are going to get exactly the same amount ever. It's going to be very different from family to family based on their household income, number of children, which child care provider they're using, the type of regulated provider that they're using. Excuse me, my voice is getting a little crackly. I've been talking all day, I'm sorry. So what is the copayment exactly? The copayment, the intention is twofold actually for copayments. Number one, to ensure that each family has some obligation for the cost of their child care. And number two, as the family's household increases, so will the hourly copayment. The household income changes are only applied once per year at the time of the annual renewal. So when a family's income increases, the copayment increase will not take place until the annual renewal, giving the family a period of time to adjust their household budget to that change. Once the family's household income exceeds 200% of the FPL, the copayment will increase more rapidly at $1 for every additional $3 in new earnings. This is known as the exit period. And there will be more about that coming up later. One of the changes that we made when we implemented the Child Care Development Block Grant reauthorization is we changed from we changed the copayment to be a per hour copayment, so that fluctuations would be reduced greatly. And we also changed to not apply these changes until the time of the family's eligibility renewal. Previously, there were lots of monthly fluctuations in the amount of the subsidy because all of the changes would be applied immediately. So what we are doing now is we are ensuring that there's a stable amount from month to month in the subsidy benefit amount until the family's eligibility renewal, at which time all of the changes would then be applied. We have found that many families are confused by that because they are surprised when they do their annual renewal and now their benefit amount has changed. However, we're hoping that through some more education to families, they'll understand how that has changed from previous years. So program changes from 2016 to 2018. So this is going to kind of show you in a nutshell what we did. So the CCDBG was reauthorized in 2014, which required states to fully implement the changes by October 2018. So between 2016 and 2018, we implemented many changes. First was the transition to the EBT card, and many of the changes that are now considered more family friendly, which promote the continuity of care for children. We raised the ongoing eligibility maximum income to 85% of the state median income. That's the maximum allowed by the Child Care Development Block Grant. We created 12-month eligibility periods. Previously, there was a 6-month eligibility period, at which point at the 6-month point in time, the family would need to submit a 6-month report and not necessarily do a full eligibility renewal. That would happen annually. But we've eliminated that 6-month report form and truly have 12-month eligibility periods now. Like I said a little bit earlier, we reduced the monthly subsidy fluctuations by creating an hourly copayment and only applying those changes at the time of the renewal. We created an activity break period where the subsidy benefit can continue for up to 3 months following the parent's loss of a job or a temporary layoff or other temporary or permanent break in the parent's approved activity. This creates some continuity for the children who may be enrolled in a high quality program, for the child to continue in that care setting while the parent continues to look for another job or another activity. The copayment periods that we also implemented at that point in time are kind of shown in the chart there below. So when families' household income is below 190% of the FPL, they're in a period what we call copayment stabilization. That means no matter what, during that 12-month eligibility period, their copayment will not increase. At the annual renewal, if their household income is between 190 and 199% FPL, where they're in a phase we call the gradual phase out period. And at that point in time, the income can fluctuate. It may increase up until the household income would reach 200% of the FPL, but not go beyond that. And then when the household income is beyond the 200% FPL, They're in what we're considering the exit period. And that's the point in time where the copayment will increase by $1 for every $3 that gain in income. Also, during that exit period, the copayment can fluctuate from month to month if the household income fluctuates from month to month. This is kind of to help them get used to the out-of-pocket costs that will occur with paying their own full cost of childcare. Another thing that we have available is a parent and provider portals. These are web-based places where families and childcare providers can submit information. Parents can request an authorization. They can request a change to their authorization. They can submit information that may have changed. Their schedule may have changed. They can change their childcare provider, and they will also receive text messages when the local agency worker has sent them a question back to obtain any necessary information about their childcare authorization. Providers also have a portal where they can view all eligibility information, eligibility status, authorizations. They can send a request to end an authorization for a family who's no longer attending. They can report temporary closures. They can view their Youngstar quality rating. They can also access a variety of licensing and certification documents through that webpage. So really that is the presentation. So I am ready and Barb is ready to help with any questions that you may have. I haven't been watching the chat, so I'm not sure if questions have come in.
Yeah, if you stop sharing the screen, I don't think any questions have come in through the chat as far as I can tell.
Okay.
But first of all, before we get started, let me say thank you very much for all of that information. That is a ton of information, and we thank you for pulling that together. If people want to just unmute, we can ask questions, or people can type questions in the chat box. I have a question. Jane has a question, so I saw Jane's hand go up. So Jane, you want to start?
The one statement that caught my ear was that children must attend a regulated childcare provider, meaning licensed, certified, or operated by Wisconsin Public School Board. So licensed can be a group childcare provider or an individual childcare provider. Is that correct?
Right. There can be licensed group programs and there can be licensed programs that take place in a family's home.
And then certified means what?
Certified is a lesser amount of regulations that a provider would need to follow. However, it's not a whole lot less. Certification is done more by local agencies. Licensing is done by the Department of Children and Families directly.
And
Barb can, I'm sorry, I was just going to say, Barb can probably explain a whole lot more about certification than I can.
Okay. And then the last part of the question is, do you have a resource that we could read, look at, that explains what is required to be licensed or certified?
Yes, that information is available on the Department of Children and Families website. Barb, are you able to locate that quickly? Because we can share that webpage. There's a webpage, all of the information that a provider would need to become certified or licensed is available on the webpage.
And actually, I'm going to add a little bit more question. In your opinion, and it might sound a little odd, maybe it's, I hope it's appropriate. In your opinion, how difficult or not is it for an individual childcare provider to meet the licensing or certification requirements?
I personally don't know, but I do know that one of the changes that occurred with the Child Care Development Block Grant requirements at the federal level were the background check requirements. That was a big hurdle for a lot of providers. All of the employees and anybody who has contact with children needed to complete the background check, including the FBI background check. And if they had resided outside of the state of Wisconsin, it would include a background check for that other state. So I think that was one of the biggest hurdles outside of regulation, outside of the direct program regulation. Those background checks, I think, were quite a hurdle for programs to get through.
Is that because of availability of the checking facility or the cost of it, or why was that a big hurdle?
I think it was a hurdle for agencies to get through because there were a lot of people who were employed at child care programs who maybe had an offense in their background that would not allow them to work at a child care program, which did impact staffing levels.
Huh. Okay,
Wow.
thank you.
I'll just jump in here and let you know that the certification process, as Rose said, happens at the local level. Here in Door County, because we really have a fairly low volume, unfortunately, of in-home certified providers, we contract with Brown County Department of Health and Human Services to do our certification. But we have had the certifier come up and do presentations in the past, trying to drum up interest and get people willing to apply for certification. And the information she presents leads me to believe that it's not nearly as difficult as people might believe to meet those requirements.
Okay.
And we've tried to do things like waive the certification fee or come up with mini grants to help with any minor home modifications that might be needed, those types of things. The biggest barrier for us is just getting people interested in being a provider.
Okay, thank you very much.
Alexis?
Thanks. I just had one quick one that kind of dovetailed off what Corey just said. So I just wanted to jump in. When I first started looking at this issue, I was researching the Northeast Families, I forget, but it's a consortium that, from my understanding, does like Brown, Door, Kiwani sort of thing. And I was wondering at that time and still now if it's viable or I guess worth it to start a local chapter. And I think what I just heard from Corey is that there's not really and I guess the question is, am I understanding what that is? And then is it worth trying to get something like that started to support more people getting into that in-home situation?
So you're talking about Family and Child Care Resources of Northeast Wisconsin, I think.
Yes, I am.
And
Thank you, Corey.
That's the resource and referral agency that serves our area. Rose or Barb can correct me if I'm wrong, but I don't think you can just start up a resource and referral agency, at least not if you want to get funding from the state to operate that. They are strictly run on a regional basis and they contract with the state to provide that service. I do know that they're more than willing to be a resource for us, come up if we need them to, do whatever they can to serve our community. There might be other things that we could or should be exploring doing on a local level to support childcare providers, but I don't know if starting a separate resource and referral agency would be beneficial.
Okay, thank you for explaining what that was. That's very helpful. And that is what I was talking about.
I have a question about the copayment and changes. The information that you presented talked about, it seemed to focus on upward changes in family income and adjustments that would be made on the amount of copayment based on increases in income. Because you said for every $3 increase in family income, the family's copayment increased by $1. In general, just at any time, but now particularly in light of COVID, people may be more likely facing decreases in family income rather than increases in family income. And I'm wondering if that review or change to a family's copayment is still only done on an annual basis, or whether when there's a decrease, it happens faster. And whether DCF is doing some more, giving some more attention to this in light of COVID and changes in people's income.
Yes, that is one thing that I neglected to mention. Anytime that a family's household income drops, their copayment will drop right away. That won't wait until the annual renewal.
Thank you.
Mm-hmm.
And do you have information, just, this is a way off data geek question, but do you have data on over time trends, like the number of families who tend to have an increase in income over 1 or 2 years, the number who decrease? And you said mostly a lot of people stay the same. Do you have, can you give me any more numbers on that?
Not right now, but we do have a research grant that we have gotten some funding to do to evaluate the implementation of the Child Care Development Block Grant, which is going to do exactly that. One of the things it's going to look at is how did implementation of this new law affect families over time? Did it have a positive effect or no effect? So that we will be looking at that. That research project is ongoing at this point in time. So that will come out sooner or later. I'm not sure exactly when, but it'll be a couple of years down the road.
I'm happy to hear that it's underway.
Christina, you have a question in the chat box.
Oh, thank you, Amy. I'm not looking. So we've got from Terry, why is the SHARE program a good option for Door County families or those in rural areas overall?
I would say it's a good option for any family who is financially eligible and has an approved activity to participate in the program. The challenge, though, is finding a child care provider who can accept Wisconsin shares. That's getting to be more and more of a problem across the state because we're finding a lot of child care deserts across the state, areas where there are not enough child care providers to serve the families. One thing that I live in Marquette County right now, and I think there's one regulated provider in the county outside of Head Start programs. And my granddaughters for their entire lives never attended a regulated child care provider because there weren't any. My grandson right now is a 6-month-old baby and he's not being cared by a regulated provider either because there isn't one. So that's the case with a lot of families across Wisconsin right now. They're using unregulated family friend, neighbor, or anybody who will watch the child so that they can keep their job because there are not providers available. Mm-hmm.
I have a question. I was curious when you were talking about the income skew for families and how it seems like there are many more families at the lower end of the range. Are there any families being turned away who would qualify, but the program does not have the funding for them? Or is it more of an issue of finding the proper childcare options in their area?
No, we have not had a waiting list in this program. So no families are turned away because there's not funding available. It's more that they're not served because they weren't able to locate a child care provider.
And then, sorry, this is a follow-up and I just want to make sure I'm getting it right. Is the greatest challenge to the program right now that you can't find licensed or certified childcare options for people or families?
That is a very significant problem in many areas of the state outside, especially rural areas. You know, in Madison and Milwaukee and La Crosse and a few other larger communities, it's not so much of a problem, but you get into a rural area and it certainly is a problem.
Yeah, and I would say here in Door County, it's a twofold problem. One, we don't have an adequate supply of childcare. And two, we have families that even if they could get a spot in a regulated childcare facility, can't afford their portion, even with Wisconsin shares. So they're choosing to use unregulated care because they find it more affordable.
Okay.
And that was the question I had as a follow-up. The reading that I've done, I think across states, maybe the proportion that is covered by a subsidy program differs across states. And so and I think I've read something where Wisconsin tends to be on the lower end. Are there discussions about increasing the amount of the subsidy while still having families be responsible, have that buy-in into paying for the care?
Any increase in rates is dependent on the state budget. So it would depend, it actually is a legislative act that would allow us to increase those benefits or that subsidy rate, the hourly rate for providers. So it's a possibility. In the last few years, there's been several increases to the reimbursement rates. For example, infants now are always going to be subsidized at $5 per hour. But that's one of the recent increases. We are close to 35% of the actual cost of care for most child care providers, but that's, as you know, it's just nowhere near the actual cost of care. The copayment has no relation to the actual cost of care. So yeah, I think 20 years ago, it may have been closer to the actual cost of care, but we had a freeze in reimbursement rates for several years, I think from 2005 to nearly 2010. So that freeze resulted in a long period of time where there was no increase and the prices continued to go up, and we were frozen because of an act of the legislature.
Anika, you had a question earlier about if someone was possibly turned away for Wisconsin shares. And I just wanted to kind of make a point that even though somebody might be determined that they would be eligible for Wisconsin shares, in the PowerPoint presentation, Rose had a slide that says other eligibility requirements. So it's quite possible if somebody doesn't turn in one of these verifications that their eligibility would be denied because of not producing these verifications. So it's not that they would be not eligible because of Wisconsin shares not having enough money. It's basically the parents not producing this verification. That happens quite often where they apply and then they just don't follow through.
Yeah, we also have a lot of parents, I'm sorry to jump in, have a lot of parents who request childcare assistance but aren't in a qualifying activity. So they're not going to be able to get shares assistance. If they're not working or in one of those other qualifying activities. So for example, if somebody just wants childcare to come to mental health treatment, but they're not working, that would be a barrier.
So we've got Amy and Margie, and Terry's got a question in the chat. So let's start with Amy.
I just wanted to add in on the parent payment piece. So when we were talking about parents maybe not being able to afford their part after the Wisconsin Shares subsidy, that's where at Northern Door Children's Center and now the Door Community Child Development Center, United Way grants dollars from their annual campaign to those organizations to then do additional scholarships on top of that subsidy. So if that parent payment maybe is $100, that family might be able to receive another $20 through that scholarship program that center has to reduce then their payment to $80 in hopes of making that a little more affordable for that family.
Margie?
Let me make sure I'm on mute.
You're good. Oh, no, now you just muted yourself.
There we go. I'm curious, what's your sense of the biggest limiting factors to family homes, home-based care, not taking the path of certification or regulation?
I'm not sure that I can answer that question, but maybe Corey or Barb have some insight.
I think our economy here in Door County is pretty unique with the tourism industry, and we're finding that a lot of people feel that they can make more money working a seasonal job in hospitality than they can doing childcare. So I think it's often a financial business decision. And then, as I said, also some misconception about how much goes into the certification process and a feeling that it might be kind of daunting. Some people might have a real passion for working with kids, but don't want to handle the business side of things. So we've been looking at some potential models to try to address that barrier. We could provide some kind of administrative assistance on a county-wide level.
Yeah, and just to add to that, I think, you know, a lot of people don't want to do a fingerprint check or their background checks. They know that they might fail those. Another thing is to do a home inspection. They don't want anybody in their homes. Just different things like that, or they might be living with somebody that has a background check that wouldn't pass as well. There's a lot of just different things that just after they find out about the program, it deters them from actually following through those applications.
I see.
As a follow-up, are there any certified, regulated family home care settings in Door County?
Yes, last time I looked, we had 3, I believe, 3 or 4. So a very limited number.
Right.
So I'll go to Terry's question. He says, and I'm not sure if you guys can answer this, but we'll give it a try. Have employers ever been approached for helping aid childcare for employees, possibly by getting subsidies to establish a care facility or pooling resources with other employers? So I think the issue is, could we serve more people by providing financial support to employers rather than individual families, if I understand Terry's question?
I think that's an excellent option to help address the childcare need.
Yeah.
I think it probably has happened a few times across the state at different points in time, but I think right now that's a really good solution to address some of these needs.
Yeah.
Could I follow up on that? So I think we have tried reaching out to the employer community to try to generate some interest and look at some creative solutions. But if I understood Terry's question right, or at least the way Christina framed it, it was about actually having a subsidy go directly to that employer.
That's the way I understood his question also.
Yeah, and so I don't know if through shares there's any avenue to do that other than those qualified parents who would use the center would be able to get shares to help pay for the cost of the care.
Correct.
Yeah, that was actually what I was trying to get across there. It translated the question fine.
Yeah, at this point in time, that's not an option, but you never know in the future. There may be a decision that there would be funding directly to a program to subsidize care. But at this point in time, that's not an option for the subsidy dollars.
Jane?
And then you would still, though, have the problem of finding staff to staff that facility, that childcare facility that the employers are putting together. So I think that's another huge problem. Sounds like.
Yeah, I think a common theme when I like the innovative ideas, because as we've talked about many times, there communities across the state, across the country are struggling to deal with providing high quality, affordable childcare to the greater community. And there's a call for more business involvement. And that it's something to explore as you dive into it. There are some challenges. It's not an easy, quick fix, but it's something that we are working on, involves a lot of discussion, potential coordination among businesses. And so it's really interesting. Everyone keeps coming back to it. So it's definitely on our radar screen also.
correct me if I'm wrong, but I believe in World War II, during World War II, and especially when you had more women that were working on the production lines, they did create child care centers, someplace they know they could put the kids in a place that they know they would be safe. They're not going to be roaming the streets, that type of thing. Maybe I thought I've heard something along that line before in talks with my elders growing up, but I don't ever recall seeing anybody that had any pictures of such things. But I was certain I'd heard that before. Did that happen? And maybe is it time to look to go back to something like that or modify it somehow? Excuse me.
People.
Go
Corey?
ahead, Corey.
I think in some communities there are employer-based childcare facilities. So in Brown County, for example, Schreiber Foods has partnered with Encompass Childcare to kind of subsidize a lot of the childcare for their employees. We have a lot of hospitals that have done similar things in this area. And here in Door County, our hospital is partnered with the Door Community Child Development Center, partly to meet the needs of their employees. So I think we just need to explore ways to expand upon that. I don't know much about what was done in World War II. It's before my time, but.
I didn't want to call on anyone.
Mine too.
And Corey, while you're, you muted, but Corey, can you see Alexis's question in the chat box? Because that's something I know you could speak to.
The 7-day limit for families to provide their fair vacation, is that a barrier? And are there local resources to help? So sometimes the time limits might be a challenge for families to get their documentation to us. We try to reach out as much as we can and follow up and help them meet that requirement. I don't know if the time limit per se is really the issue, because with some of our other eligibility programs, they have 30 days to provide verification and we still have trouble getting it back. In terms of resources to help, our income maintenance staff who handle the eligibility for shares are available 5 days a week. And we also we're part of the Bay Lake Consortium, so they can go through that phone line as well. I think adding the online option to help people apply has really helped. But I'm sure for some particular families, it is a challenge with those timelines. If they're working full time or juggling multiple jobs and have lots on their plate, it can be a little bit difficult.
I do want to, we're about 5 minutes past, but so I want to be mindful of Rose and Barb's time specifically. We might have a couple more questions. Are you guys able to hang on for a few more minutes?
Sure.
Maybe 5 more minutes?
Sure.
Rosemary, you're unmuted. I didn't know if you had a question.
No, I just forgot to mute it again.
No,
Yeah. Yeah.
One of the questions I had is more big picture. We've been talking about things at the family level, but when it comes to overall funding for the program and issues surrounding percent of costs covered by copayment, those are advocacy issues. And I know that part of what's going on with the preschool development grant and things at the state level, there's that group that is starting to focus more on some policy and advocacy initiatives. Rose and Barb, do you guys have any recommendations for people who want to get involved more at an advocacy level about the most effective ways, or even just the various possible ways to do that?
I don't have any direct advice at all. I'm only very peripherally involved with those preschool development grant projects, very peripherally. As far as advocacy, I always encourage folks, if you have ideas about what legislation should be to make changes, you should contact your legislators. They're a good resource for making changes.
I just want to add, there is a a website that talks about the preschool development grant, and I can put the link in the chat. So for everybody to take a peek at what it is, what's it about, the vision. There's a little video that talks about strengthening the birth to 5 state system. It's really, it has a lot of great information.
Thank you. There it is in the chat box. Yeah, I think in the big picture of addressing childcare needs across the state and access, affordability, quality, and wages, they're mindful of the advocacy perspective in that, as well as the day-to-day operations and work that people are doing. So does anybody else have a question as we sort of begin to wrap up tonight? Well, Rose and Barb, thank you very much. We appreciate it. A lot of great information and links, and I will circulate the slides to our larger community group and anyone else who follows up, share them with them. And we've got our local resources. This will also be posted on YouTube, so we'll be reaching a broader audience with that. That's our goal, is to make information available. So if they found it through a Google search that went directly to you, if they find it through our information, we just want to get the word out to people. So thank you all very much. We will, oh, Amy.
I just want to make sure we don't close the Zoom while Corey and Terry are having a chat in the chat box, Christina. So
yeah, Terry, I don't know if you saw my response in the chat. It would be helpful to wait till tomorrow if possible.
Yeah, I'm good with that. I just wanted to put it out to somebody, that should I contact you all, or should I contact, you want to try to contact me? What works?
I can contact you if you want to give me your contact information.
I believe that's in the chat room there. I put the name, the number on there, so it's.
Okay, I gotta find it.
I have it written down, Corey. I'll email it to you.
Okay.
Okay.
All right,
All right.
That would be great. That would be great. So you name
Thank
the
you.
time, or thank you.
Yep, I'll give you a call sometime tomorrow once I can connect with my income maintenance folks.
Okay.
So our next meeting will be 2 weeks from now, January 19th. I don't yet have something on the schedule, but you can be sure it's going to be informative and interesting when it actually gets on the schedule.
I'm sure it will.
Thank you all very much. If you have any ideas or topics you'd like to hear addressed, please reach out to me, and I'll work to make that happen. So otherwise, thank you all very much.
Thank you, Christina.
Thank you,
Barb.
guys. Thank you.
Thank you.
Thank
Barb and
very
Rose,
much.
good seeing you.
Thank
Thank
you.
you.
Bye-bye.
Thank you for inviting
Thank you
us.
very much.
Thanks.